Hey, colleagues, we are going to go live now. Good evening, everyone, and welcome to our electronic Board of Health meeting on January the 26th, 2022. Due to the COVID-19 pandemic, Regional Council is practicing physical distancing. I am present in the council chambers. Other members are participating electronically. I would like to acknowledge the land on which we gather virtually today is the traditional territory of the Haudenosaunee, the Anishinaabe, and the Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions to our community. What I have learned from Indigenous peoples is that our relationship to the land should be one of stewardship rather than ownership, and I am honored to make this journey with them. I'll now call on Will Short, our clerk, to do a roll call.
Thank you, Chair. Chair Redmond?
Present.
Councillor Armstrong?
Present.
Councillor Clark? Councillor Erb?
Present.
Councillor Foxton? Councillor Galloway?
Present.
Councillor Harris? Councillor Jaworski?
Present.
Councillor Jowett?
Present.
Councillor Kiefer?
Present.
Councillor McGarry?
Present.
Councillor Nowak?
Present.
Councillor Shantz?
Present.
Councillor Strickland? Councillor Verbanovic?
Present.
And regrets from Councillor Rents. Thanks, Chair.
Thank you very much, Mr. Short. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? I see none. We have no delegations. However, we do have a COVID-19 update from Dr. Wang, our Medical Officer of Health. Dr. Wang.
Good afternoon, Chair and Council. Thank you very much for the opportunity to provide an update. Kathy will project my slides, and we'll start with the first slide, which is key messages. So the status update today is 1, our hospitals remain under tremendous pressure. 2, those who are unvaccinated are at greatest risk of hospitalization and severe outcomes. 3, indicators continue to signal that we may be reaching a plateau. And 4, we continue to need to be very cautious so as to not put additional pressure on our healthcare system. Next slide, please. Regarding hospitalizations, as of January 24th, there were 144 hospitalizations in Waterloo region associated with COVID-19 and 24 patients in the ICU. This past Tuesday, the hospitals reported that approximately 250 staff from the 3 local hospitals are currently impacted by COVID-19, either off sick or isolating. I would like to once again thank our hospital and healthcare staff for working many additional and longer shifts to care for the residents of Waterloo region. Due to the pressure on the hospitals currently, residents who need non-urgent and non-emergent surgeries and procedures are not able to access services at this time. Even 2 doses of the vaccine reduces the risk of hospitalization and admission to the ICU greatly, and that protection is further enhanced with a 3rd dose, as shown in this latest updated slide from the Ontario Science Table. There are also 77 active outbreaks in high-risk settings, such as long-term care homes, retirement homes, and other congregate settings. The number of outbreaks in these settings has started to stabilize, although we still have a very high number in outbreak at this time. Next slide, please. Omicron continues to be the dominant variant detected in our wastewater. The signal for the COVID-19 virus remains high, but it has plateaued at all sites. Assuming trends continue to stabilize and subsequently decrease, it will take a number of weeks before that will translate to an easing of pressures in our hospitals and high-risk settings. And last slide, please. In conclusion, we must continue with our efforts to blunt the severity of the Omicron wave so that the province can safely and gradually reopen. the efforts that residents have taken to get vaccinated, to take public health precautions, they are working, and we need to continue with those efforts. A third dose is strongly recommended for all individuals 18 years of age and older. And finally, it is important that we continue to take a cautious approach, following public health precautions and getting a booster dose of the vaccine, or getting your first and second dose if you haven't had those yet, to induce strong immunity. Thank you. And I believe my colleague, Vickie Murray, has a vaccine rollout update.
Welcome, Vickie, and Councillor Jaworski and Galloway. I do have your names down. I think we'll get Vickie to give her update, and then you can ask your questions. So welcome, Vickie. Go ahead.
Thank you, Chair Redmond. Good afternoon, everyone. And thank you for the opportunity to join you with an update on our regional vaccine rollout. I'm going to start with a review of our numbers. As of today, our regional dashboard shows 87.93% of eligible 5+ residents have received one dose, and 82.43% of eligible 5+ residents are fully vaccinated. 52.89% of children aged 5 to 11 years old have received one dose. We have given 266,431 third doses in Waterloo region. And some great numbers here, 87.55% of 80+ residents have received their third dose, and 82.3% of 70+ have received their third dose. Our estimate is that approximately 61% of all eligible residents have received their third dose as of yesterday. Effective Monday, January 31st, we are able to welcome walk-ins for all doses and all ages at all the region of Waterloo vaccine clinics. Due to an update from the ministry regarding improved supply of the adult Pfizer vaccine, while we are still routinely offering Moderna for the over 30 age population, we can now supply the Pfizer mRNA vaccine if it is requested for all ages. We encourage everyone to take whichever vaccine is available to them and get vaccinated as soon as possible. Studies are suggesting that Moderna may provide somewhat higher antibody levels, and its protection may be more durable than Pfizer's. I've got some good news to share on our progress for vaccinating residents of long-term care and retirement homes with a fourth booster dose of vaccine. We have completed 23 out of the 24 long-term care homes in our community and 22 out of the 30 retirement homes. Due to outbreaks, the remaining long-term care homes and retirement homes should be completed in early February. Our goal is to complete fourth dose booster vaccination for the senior congregate care living centers by mid-February. I'd also like to remind eligible severely to moderately immunocompromised residents to book an appointment or walk into a vaccine clinic for a fourth dose of the vaccine as long as it has been 84 days since their third dose. A fourth dose of the mRNA vaccine will offer more protection to those who are at most risk of serious outcomes, COVID-19 and the Omicron variant. Yesterday, NACI, which is the National Advisory Committee on Immunization, strengthened their recommendation on the use of COVID-19 vaccines in children's 5 to 11 years of age. NACI now recommends that a complete series with the Pfizer vaccine should be offered to children 5 to 11 years of age. This stronger recommendation supports vaccination as an important tool to help stop the spread of COVID-19 and allow families to safely resume normal activities. Although children and youth are less likely to get very sick from COVID, they can still get sick from COVID, be infected, and not have any symptoms. They can spread the COVID-19 to others and experience longer-term effects if they do get infected. We are working closely with our local school boards to provide a variety of easy opportunities to get children vaccinated. During school clinics are being planned, along with the addition of more after-school clinics. I'm pleased to see the continued progress in our work to vaccinate our community and provide the protection that we need to be able to safely get back to our normal lives. That said, there are still almost 12,000 Waterloo Region residents who still need a first dose to get us to a 90% vaccination rate. Work continues at full speed to provide outreach opportunities to get vaccine available to everyone. Thank you.
Thank you so much, Vickie. Councillor Jaworski, please go ahead.
Well, thank you very much, Vickie, for the continued progress weekly. That's always excellent to hear. One thing to Dr. Wang, I have noticed that in our news releases that come out daily, that when we talk about the numbers of people infected, the active cases, in December, I don't really recall seeing deaths. And that's one of the most unfortunate things of the pandemic is obviously death of a loved one. Yet recently I've seen in some cases multiple deaths listed. And I was trying to see on our website if that information was there. I didn't see it. Could you just comment on that? Is it just something that it seems familiar because it's more recent to me, or is it actually happening now in January as opposed to earlier in December?
Yeah, thank you for the question, Councillor Jaworski. So due to the extraordinary spread of Omicron, the absolute number of people who have been infected, even if, for most people, it's not a severe illness, we are seeing at the same time that the province is seeing an increasing number of deaths that are associated with COVID. So either as the main cause of death or as not as the main cause of death, but that is thought to have contributed to the death. And that's very unfortunate. Every day we do publish, like we do provide the numbers to the press, which then releases that information about age and sex and things like that. But you're right. I don't think it's on our dashboard, so we'll take that back. Yeah, it is. Death is the most lagging of all the indicators. So you have infections and you have hospitalizations and outbreaks a few weeks later, and then you have the peak of deaths still a few weeks after that. So the trend that we're seeing locally is very much the same across the province. I believe today the province reported 95 deaths in total. And so it is a reflection of really what has passed, which is the extraordinary Omicron wave and the number of infections.
Thank you very much, Dr. Wang. And just for clarity, I was not actually asking. There should be a graphic. I just couldn't find it there. But if you find it valuable, I'll leave that in your capable hands. Thank you very much for your help.
Thank you, Councillor Jaworski. Councillor Galloway, please go ahead.
Thank you, Madam Chair. And thanks to Dr. Wang and to Vickie for the report. So now that case counts aren't really a reliable barometer of how things are going, and hospitalizations, ICU admissions, and of course the wastewater records are maybe a better indicator of how things are going. And maybe this question was asked previously, Dr. Wang. So you illustrated there the wastewater rates for Kitchener-Waterloo and Cambridge, and Kitchener-Waterloo each have one wastewater treatment plant. Cambridge has 3. So is that the results from one wastewater treatment plant in Cambridge, or is it blended somehow or another, that result in terms of the quantities being processed each of the 3 facilities, if you know, because the trend line was a little bit different in Cambridge than it was in Kitchener and Waterloo, I noticed.
Yeah, I believe that there are technical differences to number of sites and things like that, but really that's due to how the system is, and my understanding from the researchers is while they're only really able to do it for the 3 cities, and that what they're presenting really is the best overall picture for the the three cities in question. So what they've reported, and we'll have another update this Friday. But what they reported is, the signals now at all three in all three cities has plateaued. Previously, there was a little bit of a Waterloo still going up, while Kitchener and Cambridge seem to be plateauing. But now their signals are that all three sites are plateauing. There is some variability that we will probably continue to see, which is why we'll never really be able to be sure when it's plateaued until after it's plateaued and we're on the downward trend. So in this current time, there may be some fluctuations, but what I'm told is they look at that, not as absolutes, but with their experience and with the knowledge that's gained through wastewater monitoring across the province, in addition to here, that they're using it to sort of give that interpretation that we're now providing on our website on top of the graphs. They're kind of one or two key takeaway messages about what the trends are saying. And so based on the latest data that we have, which is from last week, it is showing signs of plateauing or stabilizing for the most part at the three sites. I'll take that question back to the team.
Sorry, Councillor Galloway, I think Mr. Schmidt wants to add to that answer before we go to your second question.
Yeah.
Through you, Madam Chair, the Cambridge data comes from the Galt wastewater treatment plant.
Okay, so it's just one plant that's being sampled. Okay.
That's correct. So all of the information Shuli's provided, Dr. Wang has provided, is related to the Galt sewer shed, but I think that's being interpolated as Cambridge and being described as Cambridge.
Okay, well, I know Councillor Kiefer thinks Preston's the center of the universe, so he might want the Preston plant sampled. I don't know. But anyway, the other thing, Madam Chair, is I just wanted to, this is really coincidental, and I know how amazing Vickie is, but I'm not sure she's quite this amazing, because as she was talking just a few minutes ago, I got an email that my mother's getting her 4th dose tomorrow. So at her retirement home. So well done. Good timing, Vickie. Exactly on cue.
Vickie actually is that good, Councillor Galloway.
Yeah.
Good news for your mom. Councillor McGarry.
I would concur, Madam Chair. Vickie is amazing, and this question's really for you. I know she's going to blush too, but it's quite true.
I am.
It's quite true. I had a couple of queries just in the last couple of days about people looking for AstraZeneca shots. But I just wanted to clarify that they're not any longer provided by any outlet here in Waterloo region. Is that correct?
Mostly. It's a bit complicated, and I'm glad to share some information on that. We are able to order doses of AstraZeneca now if we need them. If there's a special request for them, if there's a special need for them. We also are able to get the Johnson & Johnson vaccine in as well. And we have focused a little more on the Johnson & Johnson vaccine than getting in the AstraZeneca, because there does seem to be a little more demand for that as well. We certainly do understand that there are some people in the community who are more interested in getting a viral vector vaccine than getting what is the mRNA vaccines, which are the Pfizer and the Moderna. And so we do have a process for people on our website that they can book appointments for the Johnson & Johnson vaccine. And if there was someone who was really looking for the AstraZeneca over the Johnson & Johnson, they could reach out to us through our intake phone number or email, and we would follow up with them directly.
Okay, that's all good information. I'll go back to the those that were inquiring. And I see Dr. Wang has her hand up as well. Thank you.
Yeah, I'll just add that the people often who are looking for AstraZeneca are really just looking for Johnson & Johnson or AstraZeneca, right? Because they're both viral vector vaccines, kind of and very similar. So just to add that it's not necessarily always a preference for AstraZeneca as much as a preference for either AstraZeneca or Johnson & Johnson. And I know we had AstraZeneca before, and so that may be why, they're asking for that by name, but oftentimes they're fine with Johnson & Johnson as well. So anyways, as Vickie said, if they go on our website and they make a request through an online form, then we will follow up with them.
Thank you. Councillor Erb, please go ahead.
Thank you, Madam Chair, and thanks Dr. Wang and Vickie for their update and the work that you continue to do with your team. 2 questions of clarification. Did I hear it right that 61% of the people have their 3rd dose? Is that 61%?
61 of eligible people.
Of eligible people, okay.
Right. And there are people who are becoming eligible every day. So there, the number sometimes seems to crawl up because even though we're vaccinating people every day, there's more people who are becoming eligible every day as well, right? Because you do have to be 84 days from your 2nd dose.
Okay, yeah, so that's what I was going to ask. Eligibility is the 84-day criteria, which makes them more eligible. Okay. And you cited a national recommendation that came out yesterday, and I didn't quite get the name of the organization, but I was referencing that those 5 to 11 years of age have the complete vaccination. And by complete, does that mean 3 vaccinations?
Well, it's the National Committee, Advisory Committee on Immunization. So thank you. We call it NACI. And I believe they had some very specific recommendations on what should be. And from Dr. Wang, you can correct me if I get this wrong, but the way I read it was that fully vaccinated was 2 doses or a complete course. But they do have guidelines for immunocompromised 5 to 11-year-olds as well, who would get possibly 3 or 4 doses.
Dr. Wang?
Yeah, and usually after NACI or the National Advisory Committee Immunization comes out with their recommendations, that gets translated into policy decisions by the province in terms of what is offered. But the key takeaway that Vickie highlighted was that NACI just further strengthened their recommendation for the 5 to 11-year-olds. And it's still 2 doses for them at this time. But the scientists are monitoring the data, and we will see if that changes over time. But right now, it's still 2 doses.
Thank you. Okay, well, if they're calling them nasty, they should be calling you folks lovely and efficient.
Thank you very much for that. I see no further questions, colleagues. Thank you, Dr. Wang, and thank you, Vickie, as always, for your amazing work and the teams that support all the work that you do. We're now going to vote on going into closed session, and we'll reconvene at 6 o'clock. So yes, we are ahead of time, probably unheard of. I need a mover and a seconder. Moved by Councillor Kiefer, seconded by Councillor Clark. Could you please use your icons to vote yes or no? That is carried, colleagues. So you can stay on the line and simply turn off your cameras.